karunungan ay ang paggamit ng pinaka-natural sa mabisang produkto matatagpuan. Positibo sa lahat ng bagay, sa physical, emotional at spiritual, sa ganahan sa buhay, ang hangat dinuman. Noblelife, ang kalusugan ay kayamanan. Noblelife, may kayamanan sa kalusugan. Pagkakataon, tulungan ang bawat isa, na ang bawat pamilya maiwasan ang karamdaman. Isang bagong henerasyon, harapin ang hamon ng buhay. May pag-ibig, tunay na kapayapaan, tagumpay at pagkakaisa sa lipunan. Ang kalusugan ay kayamanan. May kayamanan sa kalusugan. Ang kalusugan ay kayamanan. May kayamanan sa kalusugan. Ang kalusugan ay kayamanan. Ang kalusugan ay kayamanan. May kayamanan sa kalusugan. Noblelife.
ladies and gentlemen. Okay, hello Noblelifers. Good evening, good afternoon, good morning in whichever part of the world you are, and you're very much welcome tonight with our new learnings with our health talk. Okay, so for our FB live viewers there, to our YouTube viewers, also shout out to all the viewers. And guys, let's get ready to learn something new for tonight. Okay, so we have our speaker, our very own expert in the field of medicine. Okay, so uh, without further ado, our speaker is a very much expert in the field of medicine. He is a surgeon and also uh, in the anatomy department of a school, and also he is a dean, okay, a dean of Anzar Memorial College of Medicine, okay, and he is also a president of the Philippine Academy of Anti-Aging Medicine. Wow. Okay, so and also this our speaker is a natural healing advocate. Okay, so ladies and gentlemen, without further ado, our speaker is very much excited to us and to share a lot of things with regards to our product. Okay, so there you go. Okay, let's give a hand to Dr. Allan Librando. Hello, Doc. Good evening.
Hello, good evening. Ah, good day for
How are
everyone.
you? Yes,
Kasi
Doc.
hindi ko alam, gabi ba, umaga, o tanghali ba, o hapon. Basta dito sa amin, sa Cebu, sa Pilipinas, gabi. Anyway,
Ayun.
good day everyone. It's been long. Wala na tayong, hindi na tayo nagkita. I think it was last year. We got our chance to meet again after so many
Yes.
years. And today I am tasked by my boss there, Dr. Otesa, if I can share something about Parkinson's disease, um, anong mga modalities, anong mga causes, anong mga dahilan, anong
Yes.
magagamit natin sa natural healing and mga supplements. Kagaya ng alam mo, considered sa BFAD sa atin yun, supplement yung mga cryptomonadalis tablet, yung
Yes.
PPAR natin, resveratrol,
Mhm.
and of course, yung cleanse, that's a normal, it's a detoxification. However,
Ah,
there are several studies that shows it can also have clinical upliftment or treatment, healing from this is a natural source. This source from Chlorella sorokiniana in an algae. It is a water plant, and you will be surprised. A very humble water plant, very tiny one, pero malakas pa kay Atlas. Malakas pa kay Superman. So ito, we start with
yes, give it up, Doc.
explain ako.
Okay.
Okay. So, umpisa na tayo sa Parkinson's disease. Ano ba yung Parkinson's disease? Actually, it is a disease nga nag-affect primarily sa mga nerve functions natin, yung katawan natin, yung sa utak, no? It is primarily associated with the gradual loss of cells in the substantia nigra of the brain. So, this is the whole brain, kung nakita niyo. And we have here a very tiny area. This is here, we call it the substantia nigra. And this is where ang pangyayari na magkakaroon tayo ng Parkinson's disease. Hindi naman tayo lahat, pero if you are exposed to so many things, as you will learn later on, magkakaroon tayo sigurado ng Parkinson's disease. So, alam mo, ang area na ito is responsible for the production of dopamine. Ano ba yung dopamine? Ang dopamine naman ay isang hormone na nag-allow sa pagdaan ng acetylcholine. Ano ba yung acetylcholine? Isang hormone din na siyang ginagamit sa utak natin. Parang messenger yon. Sige, punta ka doon, punta ka dito, punta ka doon, kukunin mo yan, sabihin mo sa kanya, ito. Ganon. That is the role of dopamine. So, pupunta siya sa mga muscles, pupunta siya sa mga organs natin. Kung sa muscles siya, pwede siya mag-contract, pwede mag-expand. Organ naman natin, pwede siyang lalabas ang mga hormones, lalabas ang pawis, lalabas, tutulo yung laway, tutulo yung lalabas din yung luha natin, pati sipon. Those are autonomic nervous system functions. So, actually, dopamine is a chemical messenger that transmits signals between two regions of the brain to coordinate activity. Ayan. Nakuha ninyo yan, ha? So, ang utak natin, meron malaki ito, no? This is the main lobe of the brain, frontal lobe. This is the parietal area. This is the occipital area. Ito naman ang midbrain. Pero paliit-liit lang yan. Pero siya din ang nagdadala ng mga masilan na parte ng pangangatawan natin. Especially ditong area. This is the brainstem. Ngayon, dito ang liing natin. So kita mo, itong brain, small brain ito, it is not really actually small. Its only size is small. The only thing is that it contains a lot of functions that transmit all activities of the brain through here, papunta na sa katawan natin. Pag naputol ito, wala na. So, yung mga stroke na yan, dito karamihan nag-umpisa dito sa medulla, oblongata, dito, at saka dito. No? Dito yan. Ito naman, nasa ilong ito ha, sa harap. This is the area of the eye. Kung nakita nyo yung icon na yan, yung parang kamay, ay yung mouse. And then ito naman, this is the olfactory area. Now, bakit na-mention ko itong olfactory area? Ito naman ang unang masalanta or ma-affected ng Parkinson's disease. Kasi ang first na pangyayari dyan is years before the whole Parkinson syndrome comes in, ang unang mawalan yan is nawalan tayo ng smell. Hindi corona yan ha. Hindi coronavirus. Basta mawalan tayo ng smell. Sense of smell. Okay, so yan lang. We will go into that one later on. So, mainly ang Parkinson's disease, ang mapekto niya yung movement natin. Kaya tingnan mo yung mga matatanda dyan, mahina ng lumalakad. Tayo, mga bata pa, nung bata pa tayo, ang lakas natin, bilis tayong lumakad, takbo. Pero magkalaon as you age, parang nilalagay mo na sarili mo sa siguradong lugar bago kayo hahakbang. Right? So, those are things that is part of aging. So, sa ngayon, kung magkakaroon kayong sudden na panghihina ng paggalaw, naninigas yung mga paa, pati yung kamay mo, ayun, those are gross signs of impending attack of Parkinsonism. So the movement disorder arises due to the loss of dopaminergic neurons of the substantia nigra. So ang itong dopamine dito yan nagdadaan sa mga dendrites. Ito, nakikita mo sa left upper hand side. Makikita mo yung parang mga sanga-sanga. Those are dendrites actually. So doon dadaan. Ito naman ang axons dito. Ito naman dendrites. Okay? So doon magkakaroon ng formation of Lewy bodies. Ito, these are proteins. Alpha-synuclein. These are Lewy bodies that is pathognomonic. Ibig sabihin, pag nakita nito, 100% nagkaroon ka na ng Parkinsonism. However, hindi mo makikita sa mata. Bakit? Siyempre, bibiyakin natin yung ulo natin para i-biopsy, para makikita ito. So, patay ng tao, di ba? So, ganun lang. Those are the things that we can see. I have to present it to this in this manner para maintindihan paano yon. Ano ba yung Lewy bodies? Ano yung Lewy neurites? So, Parkinsonism is a progressive nervous system disorder that affects movement. Starting gradually, barely noticeable, ang isang very, very common symptom is tremors. Ganon. Nakikita yung kamay ko? Gumaganon yan. Para bang nagkaroon ng tremors. Tapos mamaya, nawala. Lalo na kung hawakan mo, wala. Pero kung you are doing it, letting it hang unconsciously, maya, gumaganon yan. Okay? So those are noticeable tremors in just one hand. How about in the other hand? It could be also in both hands. But lalo na kung nagkakaroon ka na ng stiffness, yung bang parang naninigas yung tuhod ko, yung kasukasuhan ko, tumitigas, ang hina, matigas itong kuwan ko, kailangan ko siya itong magmasahe. Anyway, mag-massage kayo, pero if makikita mo ito, think of several years from that moment, makikita mo, that person will surely develop Parkinsonism. Okay? Ito ang sinasabi ko sa inyo, neuron, axons, and dendrites. Ito, tingnan mo yung mga sanga. Yung sa itaas, these are normal neurons. Okay? May mga sanga, ito axons, yung may sanga, ito namang parang may paa. These are the dendrites, these are the axons. Okay? Ngayon, sa axons na yon, meron tayong receptors. Ano bang ibig sabihin ng receptors? Yung parang dorman, parang acer. Pagdaan ng dopamine galing dito sa normal neuron, galing sa nerve na yan, dadaan dito tapos maglabas o mag-release ng hormone, we call it dopamine, carrying the cholinesterase or the acetylcholine to the receiving end of the axon. Ngayon, itong receiving end of the axon, merong nag-aabang din ng mga reactive oxygen species. Itong mga reactive oxygen species, ang mangyari nun is, these are toxic oxygen. Saan galing yun? Galing din sa atmosphere. So, kung nagkakaroon kayo ng, you drink so much of, or you eat so much of toxic materials, it's bound to produce toxic oxygen. Ang molecular structure niyan is O1, that is of toxic oxygen. So, sa kuan natin, yung sa alternative medicine, we call it alternative or regenerative medicine, you call it like that. We need to detoxify. So, detoxification is kailangan yan. So, how do we detoxify? Maraming paraan. That is, meron tayong colonic detoxification, which ang common yan is labatiba or enema. Ano ba yan? Labatiba or enema. Saksak nyo sa puwet yung tubo. Tapos merong kuan dito, may tubig, warm water with soap solution, lagay doon. Tapos, o kaya, yung iba, gamit natin, coffee, enema. Tapos pasok doon sa loob. Maya-maya, wash out, i-flush out natin yung mga dumi natin. Okay? Now, meron ding yung detox, colon detox na galing sa natural sources. Okay, what are these natural sources? we have the best there is in the market. We have the best. That is your colon cleanse. Okay? So, yung colon cleanse na yan ang pinakamaganda. I've been using that one since 2010, January 2010. Those were the days, the first time that I used products of Noblelife, and I've been using that one every single day until today. Yung colon cleanse, yung pipar, resveratrol, yung cryptogonadales. Okay? So, kasi nakita ko ang effect. It is very, very nice. The best effect that I have. There are so many supplements in the market trying to imitate this one. Okay? But remember also, yung product natin is iba. Chlorella sorokiniana. Merong Chlorella varicella, merong Chlorella vulgaris, merong Chlorella pyrogenosa, merong spirulina. Those are different ones. Why? Because they have a very thick wall and we cannot imbibe, we cannot absorb the DNA that this Chlorella has. But itong Chlorella sorokiniana natin, pinakaminipis ang cell wall niyan. Pwede nang ma-absorb natin, matunaw yun sa bituka natin. Then we can imbibe, we can absorb all the DNAs, all the RNAs, and all the vitamins and minerals that we have. Ngayon, ito namang yung ibang klaseng Chlorella, ang karamihan doon, ma-absorb lang nila is ang chlorophyll. Chlorophyll is good because it can stick to the toxins like heavy metals para i-flush out yan. Ngayon, ito naman Parkinson's disease, affected neurons. Tingnan mo naman sa baba. Kukunti na lang ang dopamine. Bakit? Maliliit na ang yung nerves. Maliliit na, kukunti naman lang yung dendrites. Maski yung receptors are still there, plenty of them, kukunti lang papasok na dopamine. Kaya, ang mangyayari doon, there'll be less stimulation from the nerves. So, ang result is movement disorders. Okay? All right. Now, in the early stage of Parkinson's disease, your face may show little or no expression. Ano ba yun? Parang bland look. Parang bang nakatingin sa iyo pero hindi yung pagtingin niya hindi parang nakita ka eh. Parang tumatagos sa iyo. Then your arms may not swing when you walk. Pag naglalakad ka, magsiswing itong kamay natin. Ito naman pag Parkinson's, nakaganon lang yan. Nakaganon. Parang robot. Okay? Your speech, yung pagsalita mo, becomes soft, mahina, and slurred. Hindi maintindihan. Now, as years or days passed, the symptoms of Parkinson's disease will become worse. Especially kung hindi binibigyan ng mga supplements na nag-aalis ng mga toxin sa katawan. Okay? Now, sa paningin ng conventional medicine, Parkinson's disease cannot be cured. Medications may significantly improve your symptoms, but cannot be cured. Well, actually, that's part of aging. How can you cure age? An aging person? Nothing. Because pag nag-aging na ka na, if aging starts in your body, ang mga telomeres natin, yung sa cells natin, meron na yung mga ganon, mga telomeres, mga galamay, parang axons and dendrites. Pag bata ka pa, mahaba yan. Mahaba. Pero pag matanda ka na, lumiliit yan, paiksit, hanggang nawala na yung telomeres, patay ka na. Ang telomeres, parang siya din ang axon and dendrites inside the cell itself. Okay? So, anong cause why lumiliit o maiksi yung telomeres na yan? Telomeres are very sensitive and easily degenerate when the person or the cell is always bombarded with toxic materials. Okay, what are the common toxic materials that we can mention now? Marami. Sa environment, yung mga yung what's this? Yung mga waves, radio waves, radio waves ito sa cellphone, ano, it damage these telomeres. Ngayon, sa pagkain naman, ano naman makukuha natin sa pagkain? Yung mga glycation age products. Mga, kita mo yung mga kuhan, yung nagluluto ka, tapos meron ka, lalo na yung nag-barbecue ka, malanghap mo yung very sweet, punchy odor. Those are HCAs. We can talk about that one later on. We have that one in the next slides. Marami tayong makikita mga toxins. Pati usok sa sigarilyo, lahat. Okay. Now, occasionally naman, itong sa Parkinson's disease, pag naggrabe na ang Parkinson's disease mo, the doctor may become so aggressive, they say, you need surgery. What do you mean by surgery here? Lobotomy. Ibig sabihin, tinatanggal yung isang pinutol yung part ng utak mo, inalis. Lobotomy. Okay? So, but that is rarely done. It's only done for people who are aggressive kind of Parkinson disease, and pag alis na yung frontal lobe ng brain, parang parang nakapon. Biglang naging kalmado, very, very, very docile. Okay? So this is how it looks like. Non-motor disorders caused by Parkinson's disease. Sa utak. Tingnan mo sa utak. Lumiliit yung utak na yan. Ito namang sa mata natin. There is forced closure of the eyelids because of spasm. Yung gumagano na. Yung mata mo, tingnan mo, gumagano. Ngayon, umpisa lang, sandali lang yun. Maybe, think, are you taking so much of caffeine or coffee? Pag nagkakape ka ng mga more than 4 glasses or 4 cups, then you will experience this blepharospasm. We call it tikdoro. Pero that is because caffeine is neurotoxic. If you take it too much, that will be toxic to your brain. But caffeine will prevent Alzheimer's. It prevents Parkinson. In such a way, pag kukunti lang. So, being toxic, it will stimulate the nerve. So, pag nag-stimulate ng kukunti, ayun, maganda yon. Pero pag dami na palagi, yun, lason na yan. It also affect your bowels, your large intestines. So, magkakaroon kayo ng constipation, magkakaroon kayo ng micturition disorders, yung bang ihi ka palagi ka, you cannot control your sphincter control sa pag-ihi mo. Kaya naihi ka sa brief, sa pantalon o sa panty mo. Then siyempre, pag gano'n din, meron kayong sexual problems. Then after that, also sobrang pawis. Sobrang pawis. Pero hindi palagi yon. Meron lang, there are times that you really talagang pagpawisan ka, pero hindi naman palagi. Meron kunting problem sa salivation. Nagkuhan ka, yung sobra ng pagtulo ng laway, excessive salivation, tapos difficulty in swallowing. Minsan, mabila ako ka na, pag ganun ka. Kasi bumagsak ang bolus of saliva into your throat, and then para ka nabilawakan. And then, maya-maya, nagkaroon ka ng ubo. Tapos, nagkaroon ka ng orthostatic hypotension. Anong orthostatic hypotension? Mahilo ka because biglang bumagsak ang blood pressure mo dyan because of the uneven stimulation of your blood vessels from the brain. Okay? So, talking about Lewy bodies again, Actually, these Lewy bodies are clumps of specific proteins. We call it alpha-synuclein. They build up in the brain, especially in areas involved in memory, thinking, and movement. So, that's the reason why in Parkinsonism, nagkaroon ka ng problem sa movement, nagkaroon ka ng problem sa memory, nagkaroon ka ng problem sa pag-iisip. Because nandoon na, nagkaroon na ng blockade of these alpha-synucleins. These are proteins. Okay? These are produced in the substantia nigra itself and the locus coeruleus in the brain. And pag nandoon na yan, nako, marami ka nang nawawalang normal neurons in the brain. Okay? Now, they are also found in the cortex. Sa buo na yan. Okay? Kaya yan. Tingnan mo. Now, this is a electron microscopic enhancement superimposed upon a brain. So, electron microscopy ito, pero nilagay doon, superimpose yan sa brain. Just to show how it will affect the brain. See, these are the Lewy body formations in the brain. Now, toxins like alcohol, lithium, autoimmune diseases, genetic mutations, they destroy the Purkinje neurons. Okay? And these neurons are involved in memory, thinking, and movement. Usually starts when there is a hard time moving the body. Nahirapan ng paggalaw dahil mahina na. Makikita mo, minsan nga, ngayon, I'm already 73, no? Now, I look at my friends, my patients, even younger than me. Mahina na sila lumalakad. Sabi ko, di ba, you look like you are an athletic person before. Oo nga, pero ngayon, mahina na. Sabi ko, well, those are results of no exercise. Pero actually, I have to tell them slowly that to prevent that progression into Parkinsonism, you should return to your regular exercise. So within a year, after you nakita mo yung hard time moving the body, you start to have thinking and memory problems. Ayan, progressing na yan. So, hindi ka na nag-exercise kasi nagiging tamad ka sa pag-exercise, naku, lalo na naggrabe na ang dementia formation. Yung Parkinsonism or Lewy's dementia. Okay? So, it is similar to Alzheimer's disease actually. There will be changes in the behavior. Then you start seeing things that are not there. These are called hallucinations. Minsan nakikita mo yung mga kaluluwa ng kaya nakita mo yung matagal na namatay. So those are things, no, that you can see. Those are hallucinations. Now, these are another schematic representation of stages of Parkinson's disease. Sa normal, ito on the left side, yung may pagka-pinky, may pagka-line. Ayun. Normal pa yan, postmortem. Pero maya-maya, later on, pa nakita mo dun sa right side, atrophy, lumiliit na ang utak. We call it, in medicine, we call it Korsakoff psychosis nga. Lumiliit ang utak natin. Tapos, dahil lumiliit ang utak natin, nagkaroon na tayo ng memory problem, thinking problem, behavioral problem, masungit ka na. So, ibig sabihin, nagiging matandang masungit ka na. So, those are things na you should observe. Okay? Now, what are the factors that increase the risk of developing Lewy body dementia or Parkinsonism? Edad. Karamihan from 60 years old and above are greater at risk. Sex. Karamihan lalaki. Family history. Yes. Kung nagkaroon kayo ng lola at lolo na nagkaroon ng dementia, behavioral problem, Parkinsonism, usually will 80-90% you will have it. So nakita mo itong matanda na ito, paugod-ugod na yung ulo pag naglalakad. Ganon yun. Pati yung tinan mo, nag-tremors yung kamay niya. Tapos, nagkaroon ng stoop. Gumagano na. Hindi, you cannot walk straight. No? Because these people are now practicing sedentary lifestyle. Hindi na gumagalaw. Nakaupo more than 30 minutes, nakaupo ka dyan. There is a good possibility that you will have problems with your muscles na nagiging stiff na yon. So, kailangan i-exercise mo yan. Ha? Sit up. Ganun lang. Ako nga, I experienced that one, especially if I am in my office. Nakaupo ka lang, marami kang ginagawa, maya-maya. Para bang, kumakala itong kwan, itong gastrocnemius ko, yung binti, parang gumagalaw parang nagkakaroon ko ng restless leg syndrome. Kailangan igalaw ko yon. Tapos maya-maya, nakatayo na ko, naglakad-lakad, balik na naman. Because we need some exercise. Okay? Especially if you're used to it when you were still younger. So, shuffling walk. No? Shuffling walk. Yung naglalakad ka na gumaganon lang. Nagsashuffle ka. And then, there will be slow movement or a frozen stance. Anong frozen stance? Para bang robot ka lang. Hindi ka, tinatawag ka, gumaganon ka lang. Ganon yan. There will be problems with the balance. Palaging natumba. Tapos stoop posture. Naka-bend. Parang nagkaroon kayo ng kyphosis. Then, loss of coordination. Hindi mo na makuan itong kamay. One of the best, simplest test for Parkinsonism and Alzheimer's is finger to nose test. Okay. Finger, sabi mo, asang kamay? Yung daliri mo, isa. Ngayon, ituro mo sa akin ang ilong. Gumaganon yan. Ganon. Sa ilong. Ilong na nga ito, Dok. Anong ilong? Hindi naman ilong. Dapat dito tayo, di ba? Ngayon, that is loss of coordination. Tapos, maya-maya, kung magsulat siya, nakita mo yung penmanship niya nung araw, yung bata pa siya, medyo malaki-laki. Ngayon, paliit ng paliit ng paliit ng paliit. Which is unusual for the person. And ang very noticeable dyan is loss of facial expression. Parang walang pakialam sa mundo. Ang mukha niya nakaganon lang. Nakamove. Parang walang expression, walang deadma. Tawag na yan, deadma. Okay, so these are the organs that are affected. Okay, for cognitive deficits, dementia, visual hallucinations, nasa brain yan. Anxiety, depression, apathy, walang pakialam, fatigue, nakuan siya yung nagkaroon siya ng palagi lang siyang tinatamad kasi maya-maya masakit ang katawan ko, ganito, marami ng mga reasons. Okay? And then, sa mata, blurred na ang visions niya, nagkaroon na siya ng kunting diplopia, yung tawag nun, strabismus, tawag namin, or libat sa Bisaya, ano bang kwan yan? Tawag sa Tagalog, hindi ko alam yan. Yung naka-cross eye. Okay? Tapos, sa ilong naman, nagkakaroon kayo ng loss of olfactory sensation. Hindi ka na maski matapang ang amoy ng yung perfume, hindi mo malasahan ang amoy dito. Okay? Sa mouth naman natin, nagkaroon tayo ng tulo ng laway, steatorrhea. Tapos, hypophonia, yung nagiging slow and slurred and blurred ang pag-uusap mo, yung pagsalita mo. Tapos, mahirapan kang paglunok, dysphagia. Maya-maya, nagkaroon ka ng mahina na yung kuwan mo, yung pitik ng yung puso. Blood pressures getting to be variable. Minsan, bumababa, tumataas, bumababa, tumataas, ganun. There will be some problems in the heart. Okay? Cardiac dysrhythmias. Sa bituka naman, reduce of gastric emptying. Nagkaroon ka na palagi ng constipation. Oh. Nagkaroon ka ng poor motility. Hindi ka na, walang utot na nagawa. Yung gas formation, there's none. Because ang motility ang movement ng intestines natin, siya ang nag-produce ng motility and nag-produce ng hangin. Kaya utot ka diyan. Bladder, incontinent ka. Basta maya-maya, mabiglang ihi ka lang. Sa genitalia, nagkaroon ka ng erectile dysfunction problem. Okay? Now, all these are associated with aging. However, even if you are still younger, like say, you're 50 years old, nagkaroon ka ng stroke, you can have these things also. Early onset of Parkinsonism also. 10 years after, nagkaroon ka na ng Parkinsonism after the first stroke. 5 to 10 years after. Okay? So, ganun yan ang mangyayari. Now, I'm talking about the outcome if there is no intervention in between. Nagkaroon ka ng insomnia, hindi ka makatulog, hallucinations. Tapos, excessive daytime sleepiness. Sa umaga, natulog. Sa gabi, hindi ka natulog. Excessive daytime sleepiness. Tapos, meron ka impulse control disorders. Para bang galit na galit ka pag hindi ka pinagbigyan. Ganon. Nagkaroon ka na nga ng dementia eh. Kaya nga, tawag na, matandang masungit. Yun ang depression. Okay? Now, what are the other pertinent, interesting features of Parkinson's Lewy dementia? Average lifespan of this Parkinsonism is about 5 to 7 years after diagnosis. So, kaya nga, pag nagkaroon na ng signs of Parkinsonism, you will not expect a longer time. Kaya, the other day, I was called by yung pamangkin ko sa pinsan. Kasi yung pinsan namin, yung mama nila, mayroong Parkinsonism. Tapos, kuwan sila, they were alarmed because hindi siya palagi natutulog, tapos ang baba na ng blood pressure. Tapos sabi ko, alam mo, nasa probinsya sila eh, sabi ko, alam mo, you have to expect the worst because he has been diagnosed with Parkinsonism already 4 years ago. Anytime she can go. So, by this time, you should prepare. So, that's it. Nagkaroon siya ng rapid eye movement sleep behavior. Yung hindi makatulog kasi yung mata mo, laging gumagalaw lang. Okay? Now, it can occur years before other symptoms occurs. Itong insomnia, ganon. Now, if you have family history of Parkinsonism, generally it will also come to you. Okay? Now, ang treatment naman doon is cholinesterase inhibitors. What is this cholinesterase inhibitors? Donepezil and rivastigmine. Pero ito naman, these are chemical medicines. Ang mangyayari doon is kung ito, rivastigmine or ribatril, they call it. Mangyayari dito is you will develop a robot-like appearance. Yun ang problema dyan. So, marami dyan ng mga anak na they worry because yung nanay nila parang robot. Minsan naman, these are the things that I have to tell my patient. There's several times nakita ko yung mga nanay nila, tatay nila, nilagay nila doon sa isang kwarto na lang na hino-host nila ang yung dumi kasi yung na masungit, hindi mo malapitan, magalit sa'yo, tapos paano namin siya linisan? Sabi ko, kunting pasensya. Because when you were young, nagtatae ka rin sa pantalon mo, tapos hinugasan ka, pinaliguan ka ng nanay, tatay mo. Ngayon, it is the time that you have to pay back to your parents. Now, itong sa ngayon, there was a movie many years back on Golden Pond. This is a movie dedicated to Parkinsonism, Alzheimer's, and dementia. That is in the English version. Yan. Sa Pilipino naman, tanging yaman. That is the pangalan ng movie na yan. Ang nagdala noon yung si Eddie Rodriguez, Eddie Garcia, yung namatay not so long ago, Gloria Sevilla, and also yung Gloria Romero, nandun sila lahat. So, they are depicting the behaviors of the olden people, which are always having trouble with the younger generation. Kasi hindi naintindihan ng mga kabataan na ito pala sakit, hindi sila masungit dahil masama ang kanila ang ugali nila. Masungit sila because that's part of their disease. Sa tawag doon, kailangan understanding. Sa amin naman, sa medicine, we call it counseling and palliative care for geriatrics. So, merong specialty yon sa mga doctors. Okay? Now, nakita ko naman na not only that, ang sa medicine, sa conventional medicine, they're only focusing on the chemical medications. Right? For example, yung donepezil and rivastigmine. But they don't care about detoxification. They don't care about supplementation. They don't care about removing the stress and depression. Wala. So, ang mangyari is, patients will really degenerate and progress into the worst kind of dementia one can have. Okay? Alam mo, yung Lewy body dementia can be prevented. Yes. You just eat healthy, well-balanced diet, no toxins containing foods, exercise regularly, interact with others socially. Kailangan social ka rin. Magsumba-sumba ka dyan. Wag na, sabi nila, marites, wag yan. Magkakaroon kayo ng yung away niyan. Yung you're always looking at another person's mga weaknesses, wag na lang. Now, do something that will stimulate your mind. Read, magbabasa ka, maglaro ka ng crossword puzzle, or learn a new language. And if I may add, learn an art, like nagpe-painting. That is part of our therapy na sa mga matatanda. Painting, singing, learning to play an instrument, because this will decrease the stress factor. Bumababa ang stress factor mo dyan pag nagkaroon ka ng bagong kaalaman. Decreases the stress factor. Then, because of the exercise, you will feel tired, so you can keep a regular sleep schedule. Now, kung nagsigarilyo yon, they have to stop it because cigarette can emit a lot of toxins into your system. And it can cause worsening of the condition. Alcohol, just in moderation. Ano ibig sabihin ng moderation? Hindi isang galon, ha? Kailangan, one shot is okay na. Isang buting beer, okay na yan. Hindi yung isang buting malaki. Yung buting regular. Huh? Okay. So, what are the common toxins that we encounter daily? This was the one that I was talking about a while ago. Yung heterocyclic amines. Okay. These are the compounds created in meats and other products that have been cooked at high temperature. Di ba mayroon tayong malanghap na pag nagtirito tayo o kaya naglitson tayo, gano'n, nag-barbecue, very high temperature yun. There is some smell, smoke that carries that sweet smell. Those are heterocyclic amines. Okay? These are toxins that goes into your system. Okay? And then also yung blackened part of the meat. These are the charred section. Yung nasusunog, dapat alisin yan. It contains HCAs or heterocyclic amines. Now, these heterocyclic amines when consumed in large amount, increases the risk of development of stomach cancer, colon cancer, and even breast cancer. I have seen a lot of my patients here having this thing. When I ask them about their eating habits, they love so much barbecue, all the time, barbecue, lechon, ganon. Kaya mataas ang rate ng stomach, colon, and breast cancers. Now, another kind of toxins that we can have is polycyclic aromatic hydrocarbons. These are part of the smoking process. So for curing a smoked ham, smoked sausage, masarap eh. Tsaka yung sa Amerika, meron silang yung smoke essence na liquid. So nagkuhan ka, nag-barbecue ka, i-brush mo lang yan, parang o nagperito ka, i-brush mo yan, parang nagkaroon na smoke na rin yung niloto mo. Pero actually, those are polycyclic aromatic hydrocarbons. If you take it so much, then you will, ingest this one, and you are not ingesting common toxins. We call it the polycyclic aromatic hydrocarbons. When this fat drips into the heat source, it causes a lot of smoke, and the smoke surrounding your food can transfer cancer-causing pH to the meat. Okay. Then the advanced glycation end products, AGE or AGE. When food is cooked at high temperature, when it is pasteurized or sterilized, it increases the formation of AGE in your food. Yung mga deep one, yung deep fry, ganun yan. Nagkaroon na yan ng AGE. Kung palagi kayong kumakain ng ganun, then it can cause a lot of ingestion of this advanced glycation end products. Then it will cause stress into your cellular stress. Hindi kayo nagde-detox. Kaya nga, I always advise my patient, oy, kayo ha, malakas kayo, lalo na Friday, nako, gimmick, kain dito, kain doon, Saturday, kain dito, kain doon. Then Sunday, you do your cleanse. Or Saturday, you start your cleanse, and then Sunday, you do another cleanse, then bahala ka na sa Monday. You imbibe all those mga PHAs, AGEs, and HCAs, yung mga toxins. But take care of the detoxification weekend. 2-3 araw. Maganda pa. So, what is the role of our cryptomonadales? Chlorella sorokiniana. I was so adamant against using it before because I don't know what it is. So, Ma'am Lila with Fern asked me to come to Manila in December 2009 and attend to the convention workshop done by Dr. Wang Sonti that time with Dr. So Injin in Manila, and that is in Araneta Coliseum. And I just sat there, and then slowly I was at the back. Slowly I inched my way to the front, and then I was getting to be interested on the topic of Chlorella sorokiniana. Then I found out that they are talking some sense in it. So they showed a lot of clinical studies. I asked a lot of questions, and then I got so satisfied with the answers. I saw the results of their studies. I keep on asking them if they can repeat these studies, and then they obliged, especially Dr. So Injin, he obliged to repeat showing the slides about that study. And when I arrived home in January, I met that patient, a cancer patient, 13-year-old, Nicole Villamor, and the rest is history. He's now married, and she is now a teacher. When she was dismissed as no more chance to live. Okay. So that is it. Chlorella sorokiniana removes toxins. The chlorophyll binds all the heavy metals and toxins and safely flush them out from your system. It nourishes your health by nourishing your cells because it contains a lot of minerals, amino acids, and vitamins that we need in our system, in our body, in order to produce a normal hormonal function. Now, other attributes of Chlorella secraniana, it can heal wounds and repair tissues. And in Saite Hospital in Japan, doctors give stomach ulcer patients with Chlorella, and in 10 days, the ulcer pains just gone, vanished. It maintains a healthy heart because Chlorella is packed with vitamins, amino acids, and minerals recommended by the American Heart Association to maintain a healthy heart. Chlorella also eases allergy. I use it to treat psoriasis. Together with my other modalities of treatment, we call it chelation therapy. I use this chlorella, I use this pipar extensively, and all patients must undergo detox by the oral cleanse, colon cleanse. Okay, so those are the things that I encounter in my clinic, in my practice, because I found out that it can prevent cancer. This Chlorella sorkiniana. It can activate your immune system. It can help increase white blood cell counts, keep restoring your health, protects your eyesight. It is very rich in carotenoids, in the B vitamins, magnesium, iron, zinc, copper, amino acids. And these minerals and vitamins and amino acids are very vital to maintaining a healthy eye. It also improves bowel movement. Ako nga, every time I drink, especially in diabetes, if palagi pataas ng sugar ko, I have to drink 45 tablets a day. Straight for 3 months. And then my blood sugar will just become normal again. So I use it to treat my diabetes. Then if the blood sugar gets normal, then I stop taking the 45. I just go back to the 1 sachet a day. It gives me back my strength and my power. And it gives me a very healthy life. Okay? Now, especially the RNA, the DNA extract, which is pure, we call it the pipar. And it's marketed in capsule form. It's pipar resveratrol because they mix it also with the resveratrol from grape seeds. Okay, this is an anti-cancer. The resveratrol is anti-cancer, whereas the RNA DNA of the pipar is pure nucleic acid. So it helps in the production of new cells. In one day, they can produce 4 cells, whereas in normal cellular function, 1 cell is produced and start to become mature on the 4th day. Okay? So these are now the products that we have. I was already telling you, cleanse, crypto, and pipar. So I guess with all this, if you do your cleansing, regular exercise, taking supplements, we can prevent Parkinsonism. I was able to prevent the progression of Parkinsonism quickly. We cannot stop it, no? But at least we can delay and give a better quality of life for the patient if they start taking all these things and they undergo chelation intravenous therapy. And patients become satisfied. And of course, there is a therapeutic dose for that, and then there is a maintenance dose. Now you cannot help it if you get older. You need to have some maintenance medicine, and the only maintenance medicine that I would prefer is the supplements and the detoxifiers. Now, if there's a need to control your blood sugar, okay, standby lang na ang mga Yung mga gamot pang diabetes, standby mo na dyan. Pag tumataas na naman ang dugo, yan, inom. Standby mo na ang ano, I'm always having in hand yung mga pang hypertension. Pag tumataas ang blood sugar, tataas din ang cholesterol, tataas din ang blood pressure. Diet first. Control the diet. Okay? Exercise, take use, cleanse, do the cleanse, take cryptomonadalis, and prepare for good health. And you'll be all right. Okay? With that, I would say thank you, and you may now throw your questions if you have.
Wow, thank you so much, Dr. Allan Librando. And see, Noblelifers, we have a great, amazing products. So, grabe. So, cleansing lang, and then the cryptomodales and our respiratory, grabe. Wow, ang daming learnings tonight. And I know one doc with Parkinson's disease, a famous one with Muhammad Ali.
Oh yeah, Muhammad Ali. Pero ang kwan niya is
It's
he
blowing,
was
you know.
able to stay longer for more than 15 years with
Right.
Parkinsonism because of supplementation,
Oh,
regular exercise, and yung diet control niya.
yes. So guys, don't forget our exercise, watch our diet, especially with the barbecue, with the uh, itim-itim na kinakain natin.
Hindi naman sa kwan, Ma'am Judy. Ma'am Judy, hindi naman sa pinagbawalan kita ng barbecue, no? You
Yung
can eat
sunog-sunog.
barbecue, but huwag naman palagi. Huwag
Oh,
naman
okay. But
palagi.
kailangan may cleansing.
Of course,
Ayun,
you need to.
yes.
I always tell my patient, look, if you eat some meat, any kind of meat,
Yeah.
whether you cook it, whether you fry it, or you barbecue it, or roasted it, don't forget the day after, take the cleanse.
Yes,
You'll be
and
all
we
right.
have the best cleanse, Doc.
Oh,
We have
of course,
the
in the market,
best
this is the one that
cleansing
I can
in the
say, I can
market.
recommend is the best. Hindi siya cumbersome. Hindi siya cumbersome. Yung iba talagang, merong isa dyan, yung original noon, yung sa kay Kwan, yung galing sa Canada. Matatakot ka dahil pagbunot mo, pag pagpunta mo sa Kwan, sa pagpupo mo doon sa CR, lumalabas, pati parang bituka na lumalabas eh.
Ayan. So, grabe, very well said ang ating product tonight together with with Parkinson's disease. Kaya guys, grabe, we need our cleansing, our cryptomonadales to prevent this type of disease like
Now, these
Parkinson's
people,
disease.
they should have seen Dr. Wang Sonti was very old, really 80 plus sometime that time that we saw him, but he was so active, never have any signs of
Tremors.
Parkinsonism. Walang tremors, wala. Kasi he's taking his medicines, his products regularly.
Yeah.
Kaya
So,
doon ako
instant
nakuha doon
tremors.
ako believe sa kanya. He just passed
Ayun.
away with natural cause, heart attack, and ganun. Wala na. Pero that's
Right.
the end. Nobody can stop death.
Yes. Yes,
But
yes.
we can give a better quality of life by
Correct.
giving them a good advice. Take your cleanse, take your crypto, take your PPAR, and do your exercise, control your diet, and that's it.
Yeah.
You can dance
Yes.
the tango, you can dance the zumba every time. Oh, ganun yan.
Yeah, and see, we have our Dr. Alan Librado with his age, but able and still doing the surgeon thing. Yeah. Are you still
Oh,
doing surgery, doc?
yes, of course. I do
Yeah.
know.
So
Na,
without with your age, without tremors, right? You should be
walang ganun
sensitive.
walang ganun.
Walang ganyan. Walang
Walang ganun.
resting tremor.
Wala, wala.
Wala. Oh, very good. Very nice. So that is our product that can prevent us from aging process and preventing our dopamine to deplete and preventing our brain from degeneration. So guys, we have this product Noblelifers. It's our time to rise up together and to shine because we have the best product in town. Okay? So everyone, thank you so much. Thank you Dr. Allan Librando, and
My pleasure.
some one short message to us though.
Well, as I said, you wanted to stay, enjoy life, have a better quality of life, do your homework. What is your homework? Exercise, diet control, take your supplements. What are the supplements that you have to take? Detoxify first. Siyempre,
Yes.
kailangan maligo ka muna, linisin. Detoxification. Then take your crypto. And then, if there's a need, take your Vipar. That's it. You will be all right.
Yes, and thank you so much, Doc. We have our assignments and we're going to do that as a
Yes.
Noblelifers here. Okay,
Okay.
Noblelifers, think and bear in mind our assignments from our very own Dr. Allan Librando. Thank you so much, Doc.
Okay.
Ayun, so grabe, ang dami nating learnings and we have assignment from our doctor. And everyone, keep on be here, keep on attending our health talk dahil madami pa po tayong malalaman sa iba't ibang mga speakers po natin. And we were going to flash our schedules here. So our reminders for the Noblelife. Okay. Ayun. Okay, thank you so much everyone. Okay, see you again to our next talk. Don't forget our doctor is in, our health talk, our for more of our programs, our platforms. Okay, be there, watch the schedules, and always watch with our YouTube channels and our Facebook Live. Okay? So, thank you so much, everyone. Good night or good morning to everyone on whichever part of the world you'll be. Okay? Thank you.
Hangahangang katangian ng isang mahusay na karunungan ay ang paggamit ng pinakanatural sa mabisang produkto matatagpuan. Oh, positibo sa lahat ng bagay, sa physical, emotional at spiritual, kasaganahan sa buhay, ang hangat dinuman. Noblelife, ang kalusugan ay kayamanan. Noblelife, may kayamanan sa kalusugan. Pagkakataon, tulungan ang bawat isa, na ang bawat pamilya maiwasan ang karamdaman. Isang bagong henerasyon, harapin ang hamon ng buhay. May pag-ibig, tunay na kapayapaan, tagumpay at pagkakaisa sa lipunan. Ang kalusugan ay kayamanan. May kayamanan sa kalusugan. Ang kalusugan ay kayamanan. May kayamanan sa kalusugan